everybody. Welcome back to Burst TV. I know I'm always excited, but I'm super, super excited about this today because I am talking with Dr. Karen Gordon. She is a hygienist. She also lives in Florida, and we have a lot to talk about, but we're going to try to keep focused on the TMJ. I hate it when people say I have TMJ. You know, and they come into the practice and they're like, oh, I have TMJ. I'm like, oh no, I have eyeballs. Oh no, I have wrists. And they're like, what? I'm like, I'm sorry. This is just a little nerdy joke. TMD is the temporal-mandibular dysfunction. That's
right.
That's the problem. When you say I have TMJ, that's just a body part. That's just the joint. But today we're going to talk about the jaw joint. Thank you so much for being here today.
Thank you so much for having me, Charlotte. You're so much fun.
Oh, I know this is going to be a really good one. Okay, I like to start out with just a random question, just a little icebreaker, because I really, no offense to anybody else out there that does interviews, I'm not officially trained to do this, so we're entering at our own risk. But I don't like that, hey, let's get to know you. Tell us a little bit about yourself, you know, because it's okay. But I would rather do something random here. So just tell me when to stop.
Stop. Okay.
If there was one thing about you you didn't want anyone else to know, what would it be?
Damn it. Could I not get a different question?
Yes. Damn it. You can't get out of it either. It's like, I triple dog dare you. There we go.
Ooh. What is it that I wouldn't want somebody else to know? Okay, this is bad. All right. This is bad, I think, because I'm a dental professional.
Yeah.
But I don't floss my teeth all the time. I'm sorry. I just don't. I tell every single person, you need to floss. You need to floss more often. Floss the teeth you want to keep. But yet still, I'm being serious. You know, I probably do it maybe 2 or 3 times a week. And I cheat because I have scalers. I'm sorry. Right. I scale my own teeth, okay. Damn it.
I'm gonna back you up on this. I pretty much floss my teeth every day. But let me say this. I clean in between my teeth every day, but I switch up how I do it. So I don't like flinging things in the bathroom with string floss. So if I use the string floss, it's in the shower. But if I use a water flossing device, it'll also be in the shower. If I'm not in the shower, I like the little flossy picks because they have the toothpick on one end. So if you got I have a little meat trap, all the beef jerky gets stuck right there. So I pick. As a hygienist, I'm sure we're very aware of where we build tartar. We're a professional, right? We've been trained to do this. And to your point, I have a 204 scaler, the 204S. I love that thing, and I do pick it.
Me too. I have a SN 135. Yeah, that's my favorite instrument.
Please don't feel bad about that. I love your honesty. Now the rest of the world knows that.
Damn it! They'll never listen to me ever again.
I'm gonna pop some other bubbles. Dental hygienists and dentists get cavities.
Damn it! Don't say it ain't so.
We get dry mouth. We drink soda. We eat candy. We chew on ice. We are human. We are, and we're all in this together, just trying to educate each other to live healthier, happier lives. That's what it's all about. So thank you for your confession. I appreciate your honesty.
No problem.
All right, so let's get back on the jaw joint. So you are a dental hygienist. You're still practicing. And then how did you get to the point where you are now a professional TMJ therapist? You are a chiropractic doctor. What made you decide to make that transition and do both of these things?
I mean, so when I first made the decision to go into chiropractic, it was really because people always came into me with pain. Patients would come in, I have, facial pain, or I'm going, I have head and neck pain. And then, I would say if I see 8 people, 3 or 4 of them would have some kind of issue with their TMJ. Yes. And to add to your point, people are like, I have TMJ. I'm like, I have one too. I got one. So yeah, right. You have TMJ dysfunction. You have temporomandibular joint dysfunction. It's not uncommon, but we all have that joint. It'd be weird if you didn't have that joint. We made that switch because it was important. It was important for me to be able to help the patients in a different way. So in chiropractic, what I realized is that lots of people, lots of chiropractors that's not really an area that some people do go into TMJ head and neck, but who better to go into TMJ head and neck than somebody that literally works in the mouth for like the last almost 20 years.
Right.
So, I lumped all that knowledge that I have, simple things I tell my patients before I became knowledgeable about the joint, in-depth knowledge about the joint and how the joints work, to what I did in practice and what I've learned to do as a chiropractor, and I kind of mesh them together. And I am still learning. It's a growth process. I won't say I'm the verified expert just quite yet. I feel like I need a few more years to be there, but I'm getting there. If you ask me anything about teeth and anything about the jaw, I know about all that. If you ask me about the joint, I know about all that. So I'm able to help my patients maneuver who they need to see, if I can treat them, and how they can help themselves. And that's what my aim is.
That's awesome. Yeah. And we talk a lot about interdisciplinary care.
Mm-hmm, mm-hmm.
But I still have this great sense that, like, as much as we say, oh, we want to do that, when you go into a dental practice, it's like your head is chopped off and they're still really focusing on the teeth for the most part. I would say for the majority of part. And it's not that we don't want to do better. I just think there's a lot of restrictions in the way that our healthcare is paid for, the time that we have, things like that. So that could be a whole other segment. But when you're talking, it reminded me of years ago, I saw it all the time where people are having headaches, neck pain, all these things that are related. But this patient came in one time and she said she had gone to a previous practice. She was complaining of some pain in her ear, teeth were sore, this kind of thing. The previous dentist said, you're losing tooth structure. We're just going to need to crown all your molars, basically. So she had some pretty major, reconstruction of back teeth. And I said, well, do you have pictures? Or, I kind of want to try to understand. And I was just getting some more information from her. And she said she didn't have cavities. They didn't say she had cracks. So there was a little miscommunication. But essentially, now she was in more pain. Her teeth weren't hitting correctly. Now it was like a shooting nerve pain, and the jaw joint was still hurting. And, just she was in a lot of pain. She was in tears, had fired the other dentist. She needed help from us. And so thankfully I worked for a nice doctor who a lot of times you treat the symptoms that patients come in with, but he was like, there might be something bigger going on here. And I could say, with the articulating paper, yes, you're hitting high here and here, and we could just take off, do adjustments. But first, do you have a chiropractor? Do you have a massage therapist? Like, we feel like you've got a lot of dysfunction. Everything's tight. Maybe go get a massage, maybe let's look at what's causing this instead of let's just go right at the teeth. And so that made me really appreciate, any caregiver that wants to look at, instead of treating one individual pinpoint little symptom and looking at things on a linear level, really looking at the big picture and like what's causing this first, and then we'll kind of funnel down from there. So in many cases, when someone comes in with a jaw issue, what do you think are the most important assessments that can be done in a dental practice to prevent a situation like she had?
I feel like something that we don't do enough of in a dental practice or in dentistry, we don't ask enough questions. And one of the questions that we should be asking, or even not using questionnaires. Questionnaires are what most therapists use, and that's what they use to address like the issues they're having or find out exactly what's going on with the patient. The patient literally always tells you what's wrong with them without you even having to go into an extensive diagnostic lab work and all that. Sometimes the patient literally already knows what it is. They already give you the information. You just have to piece it together for them. So using questionnaires are one of the first things that we can do. If someone comes in and says, well, my jaw's really been hurting, my teeth hurt, it doesn't matter what I do, it really hurts. Then it's easy just to give them that questionnaire. They fill the questionnaire out, you look at the responses, and responses tell you, they point you in the direction that you need to go. And then using that information, we're able to, okay, well, this person definitely has temporomandibular joint dysfunction based upon the answers to this questionnaire. And there is a questionnaire for that. Can't remember the name right this minute, but there's a specific questionnaire that you can use. You can find it on the internet, and that questionnaire gives you a nice guideline as to how you need to treat a patient, and it also alerts to who you need to refer to. Because sometimes what we realize is the patient doesn't necessarily have just a temporomandibular joint dysfunction. It's a whole combination of things. We have to use multimodal care in order to treat that issue. So sometimes it may be not just the chiropractor, it may be the team. It's a team approach. It might be the chiropractor with a dentist, with a psychotherapist, because, why are they having this issue in the first place? Are they stressed? Is it their bite? Do they need to see a prosthodontist? We have to kind of piecemeal out the real root cause of why they have this particular issue. Some people, especially now since the pandemic, we've been seeing in dentistry and in chiropractic too. Dentistry, from looking in the mouth, you would see people come in, all of their molars cracked. Yeah. All of their, this severe attrition. You will see them as, bruxing, people who never used to have any facial pain are complaining of this facial pain. And the first thing some people would think, it's your teeth. And really, it's not your teeth. Now you could have a nerve issue. You may have trigeminal neuralgia. You may need to see a neurologist in conjunction with everyone.
Right. And there's airway issues that cause people to snore and grind their teeth.
Right.
All kinds of assessments. So here's also a question, when we're thinking about all these various medical caregivers that could work as a team to help patients. Let's say someone's setting up a dental practice for the first time and they've just moved into an area. How do you go about making good connections with various specialists in your area, cardiologists, ENT, chiropractor? How do you suggest you put out the feelers? So I think that's really important to just know who's in your area that can help patients.
So I'm currently going through that right now. As a new practitioner, as a new practicing chiropractor, I have to find dentists who I trust in the area where I work, a neurologist who I can refer to. I'm looking for different dentists that will work with these different patients, networking and going out there. And I rely on Google, just like everybody else.
Yeah.
I read the reviews, I see what people are saying, I look at their background. For me, I'm big on like referrals. So if someone in the area knows someone, then I'll look into it that way and see if they have some similar interests that I have, and then work from there. But it's really difficult to find someone just out of the blue. Most of the people that I interact with, they have been referred to me by patients. Sometimes they've been referred to me by colleagues. I do my own research. The nice and the next biggest resource really is Facebook. Yeah. So when you go into the mommy groups in the area, or you go into similar groups that you're connected with, and you ask the question, who can I go to for XYZ? That's how I keep finding people. So for example, when I go to my doctor, I'll ask, well, who do you go for this? Oh, I use this person. And then I research them, and then, you kind of get to know them that way. And of course, you read the reviews. Google is big on a big deciding factor on whether or not I go to this place or that place. So that's pretty much how I do my research And I do the same thing with the patients. If they're looking for someone, I'll research, okay, well, these are the people that I know, do they accept their insurance? I'm not sure, but these are the people in my area that I would refer you to.
And I'm hoping with videos like this also, it'll help dental practitioners, but any consumer coming across the channel to stop and think like, okay, I feel like I've got a tooth problem, or I feel like I've got, another issue. Let's try to figure out the cause and not just the symptoms. So the internet is an amazing place. I'm so thankful for it. That's good though, that we point out.
It can be good, it can be bad. Don't be Dr. Google. I have a friend, I love her dearly, and she has Google-itis. She'll Google everything and then she'll be freaking out. Oh my God, I'm dying secretly. I'm like, no, you're fine.
It's okay.
It's
like there's a lot of great information on Google, but I always tell people go to the third page.
Mm-hmm.
Don't go to the first page. Go to the third page and then really start reading on the good literature. See who it's sponsored by, and
exactly.
Ask friends for caregivers for sure. So let's hone in on what you do as a chiropractor. And you've got patients that come in, they've got some jaw joint issues. What are some specific things that you do that you find that are the most valuable for treating jaw pain?
It's an awesome question. One of the things I use to treat jaw pain at this moment in time is relaxation techniques. You'll be surprised. Many of us don't know how to breathe.
Right. And
many of us don't know how to relax. One, I always find out what the real issue is. Sometimes it's the patient is more emotional than that, basically physical. Most of the time when patients have pain, it's literally directly related to emotional stress or some kind of emotional trauma or some kind of change in their life. And so they don't know how.
Because I know we do this as hygienists, we're therapists. All you have to do is ask someone a question. How are you doing today?
Exactly.
Open, so you're not just hands-on treating patients. This is also an emotional roller coaster as a caregiver.
Exactly. If I talk to them and I'm realizing that this is just more than just a physical pain, it's connected emotionally to whatever they're experiencing. I may suggest, okay, along with our treatments, maybe you want to see a therapist, to discuss these issues. But I always talk to my patients. That's first and foremost, getting comfortable with the patient. I don't want to put my hands on someone if they're not comfortable with me putting my hands on them.
Right.
Number one. Things I do a lot of, I do instrument assisted soft tissue manipulation where, it's almost like I use gua sha, that technique, to kind of tonify the muscles and tone down the muscle, reduce the tension in the face. I use a combination of hot and cold therapy, depending on how severe their issue is. We do specific techniques that assist with how would you say now, with moving the jaw. We need to sometimes do jaw mobilization, and that just helps them guide where the jaw joint needs to move, where the mandible needs to move in the maxilla. And exercise techniques. Exercise is very big. One of the things we need to do is retrain behavior. Sometimes patients have poor behavioral habits, just like we do in hygiene. The same principle applies. We have to retrain and introduce new behaviors. So if this patient was a person chewing on their fingernails all day long, hello, that's not going to help you, right? We need to.
Things that come up too. I remember after I had one of my daughters, I think it was the pain medications that they gave me, I found myself pursing my lips. Never done that in my life. And when I was stressed out, I would purse. I caught myself doing it one day, and my mom caught me, and she's like, I know you're stressed out and I don't want to make it worse, but you're pursing your lips. And I was like, oh gosh, yeah, that's why I'm very not relaxed right now. So it took a while for me to recognize that and just relax.
Exactly. And those are the things when they come in for treatment. Of course, we do chiropractic adjustments. That's just one component. That's not a permanent fix. It's just a way for you to have some relief.
Right.
I can't cure your grinding at night if you still stress out. I can't cure that. I can give you the tools that you need for me to work on those areas so that you are not so stressed out. So simple things I recommend to my patients: drink some chamomile tea before you go to bed. You know, turn the TV off. Don't listen to the news. Read a book. Those things are easy things you can incorporate into your everyday routine as anyone. You know, it doesn't take much. It doesn't cost anything. Just learning how to wind down. And those are the first things I depart to a patient. And before I even touch the patient, I need them to be comfortable with me. Something I bring over from dentistry: if you have a patient that's scared, are you going to put the sharp, nice, long S135 into their mouth? Okay, no. You're going to try and find a way for them to trust you before you actually go into any kind of therapy or treatment. So that's the first step. Second step is really identifying, like, how bad is it? Is this something I can treat? Do I need to have someone else help me? Because I'm not it and the end all. If I realize that, man, your teeth are really 90% of what your issue is your teeth, and you have misalignment, you know, you may need to consult with several different people, not just me working with you. And I'm not going to say I can cure you, but I can definitely give the tools that you can be successful. So do I need to refer you out to an orthodontist? Do I need to refer you out to the dentist because you have, you know, severe bruxism? Do you need a night guard? Stuff like that. Those are the ways that I try to help a patient. The physical stuff, the touching, you know, where I go in and I actually manipulate the jaw, or I work on intraorally with the tissue. That's something I can do, but it just depends on what stage this particular person's dysfunction is at. If their jaw comes in and to that side, and they're like, oh, I'm like, I can't help you. You know, you need other help. You know, yeah, you need someone else.
And do you do acupuncture as well?
Yes, we can use acupuncture and acupressure techniques into the temporomandibular joint, and that helps to redirect where that energy or that chi is. It helps to reduce the muscle tension in the temporomandibular joint, and it also helps with you know, desensitizing the nerve. A lot of the work that we do manually helps to redirect and desensitize the nerve, and help with reducing muscle tension. Because if you have, you know, tension in the face and jaw, head and neck, then you're always going to have that issue. If we are able to release that tension, then we can reduce the amount of pain and discomfort in that area.
And then it trickles down to the rest of your body too. I mean, it really only takes one shoulder being off, then your spine's off, then your hips off, then you've got foot problems. I mean, it's just all connected. And that's what I appreciate so much about you, is that you're a mom, so you're a caregiver. So you're just rocking that role, and you can bring that into helping your patients, you know, that emotional part of it. Because there are a lot of practitioners that are very, let's just treat the symptom. They don't pause to make sure that the patient's relaxed. So I think that's very important, and being able to use that psychology as well. But then you've got all this dental experience, all this head and neck experience, and then you're able to translate that into chiropractic care. So it's just an amazing mashup of experience that you got. And I want to know more about, where can people find you if they have some questions. They can put them in the comments on the YouTube video here, and I'll make sure that they can get a hold of you. But I want to hear about the practice that you're at. You're in Palm Beach, is that right?
Yes, I'm in Palm Beach Gardens. The practice is called Lux Wellness Chiropractic. And we are a small office. It's fairly new. And if they need to find me, they can find me at Instagram under the tag name, the TMJ Therapist. I'm pretty good at responding to people. If they send me a message, I'll respond right away. They can also email me at luxwellnesspga@gmail.com. I have to think about that. Lux Wellness.
I'll make sure to put it here so people can read it too.
luxwellnesspga@gmail.com. Usually Instagram is the first place you can meet me. I'm on there all the time. Yeah, you know, if you send me a message, I'll quickly respond.
That's how I found
yeah, see, and I responded quickly, like, hey,
like very quickly. I was like, oh, I'm so excited.
I'm pretty easy to talk to. I think I am somewhat.
Yeah, kind of.
Yeah, kind of easy to talk to. So, and then when I'm not at my office, I am in a dental office. I work for a company called Dental. So if I'm not there, I'm there. I literally was talking to a friend of mine, and we were talking about returning back to the office. Now we're going to see a lot of people coming back and really hating life because they have to go back to a physical job. And she's like, I don't know why I'm so angry. I don't know. So you know what that means. You're going to be angry. You're going to be stressed out. You're going to come in with jaw pain. You can come in with facial pain. You can come in neck pain, muscle pain, upper shoulder and back pain, all stemming from you clenching your teeth and grinding it at night. And we're going to see more of that once people start returning to work. I'm anticipating this load of headaches and, this constant tension headaches.
Looking back, I do miss my clinical career, but if you said tomorrow, Charlotte, you need to go back to treating patients, I would be definitely stressed out about that. I love my patients, and that's what I always focused on, is like, let's focus on the positive. You're helping people, and it's physical, and it's hands-on, it's instant gratification, but it is physically and emotionally taxing. And so that's just a reminder to everybody watching. It doesn't matter what industry you're in, if you're healthcare or not, relax, try to find this balance in your life. It's just our reminder here in what little way that we can help you guys to take the time to take care of yourself. If you're not taking care of yourself, you're not going to be able to be useful to anybody else that's around you. And it's
exactly.
It just trickles from there. So breathe, relax.
And that's exactly what I tell my patients. Like, you need to step back and smell the roses. Yeah. Maybe not the roses because you have allergies, but maybe the coffee.
I don't know. What else? Popcorn, that's my favorite.
Yeah, the popcorn, the cupcake that you've been thinking about, so stop back and just calm down and take it one day at a time. I was just watching something on TikTok, and the lady said, at first she was so excited to go back to work, and when the reality hit that she has to go back to work, it really wasn't that sweet. It was sour sweet. And I was literally just talking to a friend, and the same thing, that realization that they're going to be going back into the very physically and stressfully, mentally demanding space is going to change like how they're going to treat their bodies. And if you don't remember how to treat your body and take care of yourself, and you dive back in, then you're going to go in that spiral again.
There will be a transition period where you adjust anyway, just physically. I remember going from where I sat down a lot to standing up a lot and somewhere in my life at work. And then I went from standing up a lot to sitting down again. And even going from clinical to working at a desk, I was having, it's just an adjustment period where you're like, what do I need to do in the career that I am in to take breaks, to stretch, to what do I need to do with my exercise? What do I need to do mentally, whether it's meditation or whatnot, to just balance it out. So
it's so even though we're talking about work, it's the same thing with the TMJ and TMJ dysfunction. When patients come into you, they don't just wake up with this facial pain or jaw pain or tooth pain. When this pandemic first started, I woke up with facial pain.
Yeah.
Every single day. Why? I didn't even know I was clenching my teeth. I'd wake myself up with this clenching and this tightness in my jaw, and my neck would hurt. It's like you're angry.
I'm upset, and I was supposed to be resting. That's not a good way to start your day.
No, and then what people don't realize too, it's not just adults. Children have different ways in which they express or contain their energy. Kids will say, well, my neck hurts or my face hurts. And you don't understand why. They shouldn't be stressed out. You see them, they're gnashing their little teeth together. And what could cause this particular stress in their life that they need to focus their energies in such a way orally. It's really psychosocial and emotional is really a big component of where the source of the pain is and where it comes from. Yes, it's physical. It manifests itself as worn down teeth, worn down canines, attrition, bruxism, but joint dysfunction. But it's the source is what's important. If we don't address the source, we can always treat the physical, but the source is what we need to really treat. So even though you're coming in to see me, for just your jaw, I'll be talking to you about, okay, did we take steps today? Did you take some of my advice about the winding down technique? Have you, thought about, how you sit at your desk? How is work life? Are you okay? Is your work-life balance good? Those are important questions to ask your patients, not just as a chiropractor, but also as a dental hygienist. If you're a dental hygienist, you're working in dentistry and you're realizing that your patients are not who they were or who they can be, it's very nice to ask, how are you really doing?
Yeah.
Sometimes you don't really want to hear the answer. I mean, you could hear an earful. I'm gonna tell you, you could hear an earful.
You're gonna hear a lot.
But sometimes that patient slowly opening up to you is the difference between getting better and doing better.
Yeah.
Or I feel better and I don't feel like doing it today. You could be that change in that person's life. And that's how I address practice. Some patients come to me and I talk to them about their personal life while I'm working on them. But it's a way for them to de-stress. It's a way for them to kind of reevaluate, and I don't judge them. And you can't judge someone because they're feeling sick and they don't know what to do. Your job is to help them.
Yeah, they're coming to you for help. It's very, very important to ask people how they're doing, and find someone like Dr. Gordon that isn't just gonna pop and crack and treat the symptoms, much like you wouldn't want to just look at a single broken tooth or, cracked tooth or things like that and just fixing teeth. Like, let's treat the whole person. I think that's the takeaway from all of this. I really appreciate you taking the time to come on to Burst TV. You guys, if you have questions, find her on Instagram. She will get back to you, I promise. And I'll leave a lot of information and resources down in the description of this video as well. And of course, please, if this was even somewhat valuable or entertaining, and even just to thank Dr. Gordon for spending some time with us, hit the thumbs up and subscribe to the channel so that we can see that you are here. Hit it. Thank you so much. We'll see you guys next time on Burst TV.
Bye.